All right, I'm going to go ahead and get started while the handouts are going around the room. There are copies of the slides that are coming around, so if anyone wants to take notes. And then there are a couple additional handouts that will come around a little bit later. So my name is Megan Benson. I'm the Director of Community Education for Planned Parenthood of Wisconsin. And today I'm going to be talking with you all about navigating confidentiality with teens around sexual and reproductive health services. All right, so these are our learning objectives for today. We just want to make sure that everyone can explain the rights of minors to access confidential reproductive health services in Wisconsin, and to identify the exceptions and limitations of confidential services for minors. I am going to review what health services can be provided to minors confidentially, why it's important to provide these services confidentially, and then we will talk a little bit about mandatory reporting, including the exemption for healthcare providers regarding reporting on minor sexual activity, and whether or not to disclose this requirement to minor patients. And then also tips for healthcare providers on protecting minors' confidentiality. So, why do we provide confidential health services to minors? The first is that fear of disclosure, in particular to parents and guardians, prevents minors from accessing certain healthcare services. Additionally, even though we all know that parent or guardian involvement is ideal, it's not possible for all young people, especially if we're talking about young people who are maybe in an abusive family situation, or young people whose parents really don't want them accessing certain services, such as reproductive and sexual health services. This is absolutely evidence-based policy. We have a lot of research that supports the provision of confidential services for minors. There's one really interesting study that was done in federally funded Title X health centers that found that only 1% of minor patients would continue coming to the health center to access services if their parents' permission was required. So we know that if these provisions were not in place in order for minors to access these services, there's a good likelihood that they wouldn't access them, which would put them at risk for all sorts of things: unintended pregnancies, untreated sexually transmitted infections, and many, many other concerns. And then finally, access to confidential health services is supported by professional medical organizations, so ACOG, the American Academy of Pediatrics, the adolescent medicine folks. They all support providing these services to minors confidentially. So when we talk about minors, we're generally talking about people who are age 17 and under. There are some exceptions. So in Wisconsin, we do have emancipated minors, so people under the age of 18 who can consent to any medical care for themselves. Emancipated minors are individuals who are or ever have been married, women under the age of 18 who have given birth, or anyone under the age of 18 who has been freed from the care, custody, and control of their parents by the court. So these are the folks in Wisconsin who are considered emancipated minors, and they can consent to any medical care for themselves. So when we're talking about minors who are not emancipated, so those most 17-year-olds and under, Wisconsin law gives minors the right to consent to medical care under certain circumstances. The first one is reproductive health care services, and I will go into detail about which particular services these are. Emergency care, drug and alcohol abuse care, and again, there are certain types of drug and alcohol abuse care that can be provided confidentially to minors, and I actually have another handout that will go through that in more detail, so if folks are more interested in drug and alcohol abuse treatment, this handout will explain kind of what situations you can offer that care confidentially in. And then finally, blood donations. So in Wisconsin, anyone 17 years old or older can donate blood. If someone is 16 years or younger, they can still donate blood, but they do need a parent or guardian's consent in order to do so. So again, under Wisconsin law, healthcare providers must obtain consent from a minor patient in order to inform that minor's parent or guardian if they have been diagnosed or treated with pregnancy, sexually transmitted infections, drug or alcohol abuse. So again, providers do need consent from the minor to talk to the parents about these particular issues. Some of the law behind the confidential access for minors, in 1977 there was a Supreme Court decision that protected a minor's right to access confidential family planning services. Because of this ruling, all health centers that receive federal Title X funding, so this is anywhere in the country, they must provide family planning services confidentially to minors. So for example, that does include Planned Parenthood health centers, and there are other health centers around the state that receive this funding, and because of this federal ruling, must provide confidential services. And then additionally, we have some other protections under Wisconsin law. In particular, Wisconsin law explicitly excludes family planning providers from the mandatory reporting of sexual activity among minors. And I will go into this in a little bit more detail because there are certain situations where a family planning healthcare provider does need to make a report about child abuse, but they don't need to report simply because they know a minor is engaging in sexual activity. So this is the list of specific reproductive health services that are offered confidentially to minors. So family planning services, including any form of contraception, IUDs, emergency contraception, anything else that's out there. Pregnancy testing, pregnancy-related care, prenatal care, and childbirth. Sexually transmitted infection testing and treatment. HIV testing and treatment. Now this HIV is treated a little differently than other sexually transmitted infections. In Wisconsin, what the state law says is that if an individual is 14 years and older, they can consent to their own HIV testing and treatment. However, the one exception would be that if their testing is being covered by Title X funding, either in part or entirely, if that testing is being funded by Title X, then those services can be provided confidentially even to someone under the age of 14. And the other thing is all of these other services that I'm mentioning, there aren't any lower age restrictions. You know, it could be a 12-year-old, a 14-year-old, a 16-year-old. They can all consent to these services on their own. And then finally, a minor can also consent to forensic medical exams after a sexual assault, although the provider would need to then report the sexual assault to the proper authorities. And again, we'll talk about that in a second. One exception to reproductive health services that can be provided confidentially to minors are abortion services. However, there are certain cases where a minor may consent to their own abortion. So first of all, a minor would need consent from a parent, guardian, or adult family member who is over the age of 25. So that could be a grandparent, aunt, uncle, or sibling. So in Wisconsin, it's not just a parental consent law, it's kind of an adult family member consent law. The vast majority of minors who are seeking abortion services in Wisconsin do end up getting this consent from an adult family member. However, there are some other circumstances where if a young person really feels they absolutely cannot talk to their family about this issue, they can consent for themselves. One of those cases would be if they are granted a judicial bypass. This is a process where a young person goes in front of a judge and explains why they are mature enough to make the decision on their own and why it's in their best interest not to tell their family. Generally, if a young person can stand up and explain that to a judge, the judge is going to grant the judicial bypass. We do not see a lot of these in Wisconsin. Again, most of the time, you know, minors do have an adult family member with them, but again, this is an option that's available for them. Minors can also consent to abortion services in a medical emergency. If the pregnancy is a result of a sexual assault, however, if that's the situation, then the minor does need to make a written statement about the sexual assault, and then the provider performing the abortion is then going to have to report that sexual assault. Additionally, a minor may consent for their own abortion services if there is a suicide risk, and this does require a written statement from a physician or psychologist that this is a risk for this particular patient. In the case of caregiver sexual abuse, a minor may consent for their own abortion services. Again, this requires a written statement from the minor, and the provider performing the abortion would need to make a report about this. And then the same if it was parent or guardian sexual abuse, a written statement from the minor, and a report must be made about the abuse. All right, so what exactly is mandatory reporting? Wisconsin law mandates that certain professionals must report any unlawful sexual contact with a minor, and we'll talk about exactly what unlawful sexual contact is in just a second. So the way the law is written, healthcare providers are included in this list, although as I mentioned earlier, there is an exception for healthcare providers that we'll talk about in a second. School teachers, school administrators, and other school staff are mandatory reporters. Child care workers and child care providers. Counselors and therapists. Social workers and public assistance workers. Law enforcement officers, and members of the clergy or other religious order. So all of these individuals under Wisconsin law are considered mandated reporters. Any person or institution who is participating in good faith and making a report about child abuse or conducting an investigation into that report, they do have immunity from any liability that results from making that report. So for example, if a mandatory reporter made a report because they were concerned that the child was in an abusive situation, and then they found out that in fact the child was not in an abusive situation, the parents couldn't sue the person who made the report or something like that. And then on the other side of things, if someone fails to make a report, intentionally fails to make a report, they may be fined up to $1,000 or thrown into jail for 6 months, which I really doubt happens very often, but that is what the law says. So when I was talking about unlawful sexual activity with a minor, in Wisconsin, an individual does not have the capacity to consent to sexual activity until the age of 18. Which means that sexual intercourse with a minor under the age of 16 is considered a felony. Sexual intercourse with a 16 or 17-year-old minor is considered a misdemeanor. And again, in this state, the difference in age between sexual partners is irrelevant. So technically, this means that if an 18-year-old is having sex with a 17-year-old, that 18-year-old could be charged with statutory rape under this law. Now, does that happen very often? Probably not. But as far as this law goes, that is definitely a possibility. And certainly this age of consent law is enforced in varying different ways. You know, the police are not like running into 16-year-olds' bedrooms to see if they're having sex. But this law is out there, and certainly the intent is to protect young people. I get a lot of questions when I'm working with young people about why these laws are like this, and 16 and 17-year-olds think they're perfectly responsible and able to consent to sex, and I just have to remind young people and parents that these laws are really out there to protect young people, not to go after them, not to target them, nothing like that. So when we're talking about mandated reporters in Wisconsin, with the exception of healthcare providers, this does mean that anyone that was on that list that I just showed you a couple slides ago, if they are aware that a minor, someone under the age of 18, is engaging in sexual activity, according to this law, they do have to make a report. Now to this exemption for healthcare providers that I was talking about. Healthcare providers who are providing family planning services in Wisconsin are exempt from reporting a minor's sexual activity. So just because you know that a 16-year-old is having sex, you don't need to make a report. There may be cases where you do need to report what's going on, but just because they're having sex, you don't necessarily need to make a report. So healthcare providers do have responsibilities as mandatory reporters when a minor poses a risk to themselves or somebody else. So if there's a risk of suicide or something like that, a healthcare provider would need to report. Or if the healthcare provider suspects child abuse. This could be like physical abuse in the household. It could also be sexual abuse, and we'll kind of go into the specifics about that in just a second. So exceptions to confidentiality for minors: if a minor waives their right to confidentiality, the provider can then share the information. A minor may do this in the case of wanting to talk to a parent, but maybe not feeling comfortable doing it on their own. They may waive their right to confidentiality so that the provider, the parent, and the child can sit down and have a conversation, about the child's relationships, sexual behaviors, risks, those types of things. And then here's where we get into what types of sexual activity need to be reported by a family planning provider. So if the provider suspects that the sexual contact was with a caregiver, believes that the minor is incapable of consent due to mental illness, so if it's a 16-year-old with cognitive delays who really doesn't seem like he or she understands what they're doing, what they're consenting to, that might be a situation where a healthcare provider needs to make a report. If the provider believes that the minor is incapable of consent due to immaturity or lack of understanding, if the provider suspects that the minor was unconscious during sexual intercourse, if they suspect any type of exploitation, something like prostitution, coercion into having sex, those types of things. Or suspects that the sexual contact was not voluntary. So in cases of rape or sexual assault, the provider would want to make a report. So before I move on, does anybody have any questions about this list? Oh, yes.
How do minors waive confidentiality? Is that in writing or verbal? Like often the mother will come in with the daughter. Does this have to be written down?
I don't think it has to be written down. I believe that the consent. The question was how does a minor waive their right to confidentiality? Can it be verbal or does it need to be written? And I was just saying I believe that verbal consent is fine. In a lot of situations I know the parent is like sitting in the waiting room, and so the minor just saying, yeah, I'd like my mom to come in and all of us to talk about this should be fine. If there are concerns, if you have any concerns about maybe if you feel like the minor is kind of being coerced into giving that consent or waiving the confidentiality or pressured by the parent or something like that, it may be nice to have something written down just so you kind of have the documentation of it. But I think it's really going to be up to the provider to kind of read the situation and figure out if you need to go that far. I think in most cases the verbal consent is going to be fine. Other questions? So how to make a report. So first of all, it's a really good idea to know the policies and procedures set forth by your organization, agency, or institution before something happens. So most people who are mandatory reporters are going to receive some kind of training about their responsibility, about what they're supposed to report, about how to make a report. Hopefully your organization or institution is doing that. If you don't know if you're a mandated reporter, if you haven't received any type of training about what to report on or how to make a report, you should definitely talk with your supervisors, talk with your organization, see if that is something they can put together for you. Now, once something happens, if you're unsure about whether or not to report, just keep in mind there are other people there to support you. This isn't a decision that you need to make on your own in a split second. You can consult with your supervisor, a lead social worker at your organization, or possibly even with your legal counsel, maybe depending on what the exact situation is. But just keep that in mind. Talk with your coworkers, talk with your supervisor. They should definitely be able to help you figure out what to do in a particular situation. And then if you do decide that, yes, you do need to make a report, contact the appropriate local agency or local law enforcement agency with questions or to make a report. So that's the other thing. If you're unsure whether or not to make a report, you can call up your local child protective agency or possibly local law enforcement and just ask questions and just ask, you know, in this hypothetical situation, would I need to make a report about this? And generally, they will be helpful in letting you figure out whether or not it's something that you need to do. This is the website for local child protection service agencies. So depending on what county you are in, you will report to a different agency. If you go to this website, there's a big state map. You just click on your county, and it gives you the contact information for that particular agency. So I wanted to talk a little bit about disclosing mandatory reporting requirements to minors. And I was hoping we could have a little small group discussion activity. So if everyone could kind of just turn to, you know, maybe the 3 or 4 people kind of sitting around you and have a few-minute discussion about whether mandated reporters should disclose to minors what their responsibilities are related to reporting before starting a conversation about sex. If mandated reporters do disclose this information, do you think minors are going to be less likely to provide accurate information about their sexual partners and sexual behaviors? And then finally, if a mandated reporter doesn't disclose this information to a minor and then has to make a report, how could this potentially impact that person's relationship with the minor? So if you guys can just take like 2 or 3 minutes to talk about these questions, and then we'll come back together as a big group. All right, so if we could all come back together as a big group. And I did just want to mention during that little discussion activity, I got a couple questions about the slide where I was talking about emancipated minors in Wisconsin. And I don't know if other folks have questions about that. I did have one of our lawyers review this presentation about 3 days ago to make sure all of my legal information was correct. But I'm just wondering, did anyone else have any other questions about the emancipated minor slide or any different information about that? Yes, Paula. Yes, yeah, that was my understanding.
That does not apply to the teen father, correct? That is not.
Right, yeah, no, I think it actually has to be the female who has given birth. Yeah.
And during her pregnancy, she's not. Is that
right? Right, yeah. Although under law, she does have the ability to consent to prenatal care and things like that without her parents. I am not sure about that. I can double check though and get back to you on that.
And a lot of institutions actually do not acknowledge that being emancipated minor being illegal. So, for example, for my clinic at medical college, when the teen gives birth, she has full consenting rights for her child, but she is still to get her own flu shot. She's 15. She can consent to whatever she wants for her child, but I cannot make her parents consent to the flu shot.
And I'm not sure if folks are having trouble hearing this, but I know one of the specific questions was, or folks have run into circumstances where they have a minor who has given birth, and she can consent to medical care for her child, but is not able to consent to her own medical care. She needs her parents to provide that consent. That was not my understanding, but I will go back to our lawyer and just double check on that. And I think, Michelle, I can probably shoot you an email with clarified information that you can share with everyone.
Along that same line, is that an automatic, or would she have to go to court to get that or have some other proof?
My understanding that was automatic. So if she has ever been married or if she has ever given birth, she is considered an emancipated minor. But apparently there are some questions, and maybe it's not working that way everywhere. So again, I will clarify with our lawyer and make sure that everyone gets that information. All right. Other questions about emancipated minors? Yes.
Hold up. Was it me? Oh. You had mentioned about she can consent to her own prenatal care without her parents' consent. Mm-hmm. Is that part of the emancipated minor status, or
no? That's part of the minors being able to consent to their own reproductive health care services. So that just, like, prenatal care is the same as contraception or STI testing or treatment.
Would that include any program related to the pregnancy, like PNCC or Nurse Family Partnership or any? Because I think we're having that issue in Kenosha in regards to consent. That initial consent has to be done with a parent, there. And I'm wondering if you can find me some information.
I can definitely double check on that. I'm not sure if those services would fall under the kind of direct medical prenatal care. Right. That's where probably the issue is coming in. Yeah. Oh, microphone.
Thanks, Megan. If you could also find out what the have given birth actually means. So if they've been pregnant and had a miscarriage or did not have had a stillbirth. Okay. Because in some states the law is they have to have had a live birth.
Okay. Yes, I will definitely clarify all of those issues and shoot an email out to Michelle, which hopefully all of you will get. And I believe there's a question in the back.
I don't really have a question, but a comment regarding the prenatal care coordination and consent for minors. Technically, she doesn't need to consent to she needs to give verbal agreement to the program. She doesn't actually need to sign anything to receive PNCC. That's not a Medicaid requirement. And if she's able to consent for medical care, she's eligible for PNCC if she is on Medicaid on her own, and a minor can receive Medicaid by herself, not under her parents. So essentially Medicaid is then saying she is able to consent for her own care. What they would tell you if you called and asked them is that you need to work within your own legal department. So they're not going to give you, they're not going to go against what your legal advisors tell you for your organization. But Medicaid says that a pregnant person can be her own Medicaid member, not under her parents, regardless of age.
All right. Okay, so hopefully everyone remembers what they were talking about during their discussion. Would anybody like to share what their group discussed, kind of what you thought about these questions, whether or not you think it's important to disclose this requirement to minors? Any brave souls out there? I know you all were talking. All right, well, what was the general consensus? I guess, raise your hand. Did you think that a healthcare provider should disclose this information to minors before asking questions about sex? Yeah, kind of. All right, yeah.
Are you talking about healthcare providers in general, or are you talking about family planning providers. That was one of our discussions.
Okay, I was actually just talking about mandated reporters in general. So whether that's a healthcare provider or a social worker, an after-school program manager, anyone who might be mandated to report about a minor's sexual activity, if this is something that they should disclose. So did your kind of decision about whether or not to disclose depend on whether or not it was? Okay. All right. Yes?
Well, in our general conversation with patients coming in, especially minors, we tell them these are confidential services. There are some circumstances where we would have a responsibility to not be able to protect that confidentiality, and some of that is, it's obvious. So we kind of blanket that, but this is our entire clinic here, and we really can't remember having any. We've reported plenty of situations and never can really think that we had a teen just get furious with us or that they didn't believe we were really acting on their behalf. So really, I don't think it's been a problem. I think if you just phrase it correctly, we do everything to protect your stuff, but we also are concerned about protecting you. So.
Absolutely. Yeah, I think that's a really important message if you are disclosing this information to minors, that again, it's not about being punitive to them, but about protecting them and making sure that they're okay. Absolutely. Any other thoughts about whether to disclose this information to minors or what exactly to say? So you say these are confidential services, there may be something that comes up that we may have to break confidentiality.
I haven't a clue. I don't remember. I was dead drunk. I woke up without any clothes on. I don't have a clue. I say, that's a problem. Mm-hmm. And then I'm afraid for you. I'm afraid, So then that conversation just leads to what's best in terms of her mental health, her physical health, and that if that happened to her, potentially happened to someone else, she has no idea how many people may or may not have had sex with her. And then I say, this is a situation where I really need to contact Child Protective Services for you. Because I'm afraid for you under this circumstance. I'm afraid for it to happen again and to somebody else. And so when you phrase those things and gain that trust, I've really never had anybody get mad. And they're pretty good about savvy contacting these young people and trying to do everything they can to protect. We don't seem to have the gotcha kind of thing going on, at least not where we are. They really are. The other thing, though, I would say is that we as a practice don't go into much more detail other than, because I don't ask questions about perpetrators, I don't ask questions about ages, because then when the people that do the investigations, they want to come say where did it happen, I go, all I'm going to say is this is what the patient said to me, and then I tell the patient, and they don't always have to tell their parents. Those are different places. Some places approach them through the schools, some of them do have to have a parental or adult consent to approach the child, but if you're a trusted, established business that deals with teens, that doesn't seem to be a major problem for us.
Yeah. And I think that's another really important point that you bring up, that different agencies deal with reporting differently. So as you mentioned, depending on the situation, they may try to work with the teen and kind of try to protect confidentiality as much as possible. But certainly there may be situations where parents and guardians do need to be involved in what's going on. So any other thoughts about whether or not to disclose this requirement to minors? Does anyone have any situations where making a report has caused an issue with a minor? All right, well, I certainly think this is really about balance. You know, we do want to inform, you know, minors about our responsibilities as mandated reporters, but you don't want to do it to the point where it's going to scare them from giving you information. So again, it's just kind of balancing, letting them know that there may be certain circumstances where you may need to make a report, because then if it comes time and you do need to make a report, you disclose that information to them, so they're already aware of that. They're not going to feel like you told them that everything you say here is a secret and no one's ever going to find out, and then you have to go and make a report that's really going to violate their trust. So again, I think it's about striking balance between those two things, letting them know what your responsibilities are without scaring them out of giving you the information that you need to make sure that they're safe and healthy. Any other thoughts or comments or questions that came up during this discussion?
In my earlier years of doing family planning, I had an experience with a client who didn't really want to divulge the name of the person, but the situation warranted that I contact the Department of Social Services. And so I did that, and I explained that to her, and she was fine with that. But then the Department of Social Services was a little bit frustrated with me for doing so because she didn't want to disclose anything. So they perceived it as a waste of their time. Mm-hmm. And that is a frustrating situation to be in.
Yeah, absolutely. And if you only have so much information, or the young person's only willing to disclose so much information, the Child Protective Services or the law enforcement agency that you're working with, they may not be able to go any further. So you might know that this young person is engaging in sexual activity. Maybe they were unconscious during sex, and that's why you've made a report. But if they're refusing to tell you who it was that they were having sex with, or how old they were, or what their name is, yeah, it's gonna make it impossible for them to kind of follow up with that. And so that is absolutely always a risk, is that you know, they may not be able to follow up because they don't have enough information. Yeah.
Unconscious during sex seems to be a very, very, very common practice on college campuses, no?
For folks who didn't hear that, it was being unconscious during sex seems to be a very common practice among college campus or in college campuses, and I certainly think that's true given the culture of drugs and alcohol that we see among young people. You know, a lot of teens, a lot of young adults are having, you know, have those experiences. And I think it's unfortunate. I think we need to do a better job educating young people about making safe and healthy sexual decisions, knowing that if you're using drugs and alcohol, you're going to be a lot less likely to be protecting yourself against pregnancy or sexually transmitted infections, and things like that. So yeah, I absolutely agree that I think it's a big concern. Absolutely, yeah. I think that's another huge issue, is that nobody teaches young people what consent is, and you know, the whole kind of no means no thing really is not very helpful to young people. You know, you need to talk to young people about body language and about coercion and all sorts of things, and really helping young people understand that consent needs to be very clear, a very clear yes. It may not always be a verbal yes. It may be body language or something like that is conveying a yes. But I absolutely think that's a huge issue with the teenagers that I work with, is that nobody talks to them about what it is to get or give consent, kind of either side of the coin. Yeah. All right, any other thoughts or comments about this discussion? All right, we'll move on. All right, so here are some tips for healthcare providers on protecting minors' confidentiality. So first of all, it may be talking to the parents or guardians. So if you work with young people in a practice where their parents are often there, it might just be a matter of explaining to the parent, this is our standard practice. We talk to adolescents alone. And certainly there are, will be opportunities where you can involve the parent or the guardian, but it can be helpful just to have that as kind of a standard for all of your adolescent patients. we take time to sit down with the adolescent alone and have these conversations. And many parents are going to agree to that. Not all parents, but many. If you have a situation where a parent doesn't want to agree to that, you may be able to connect with the patient in another way. So if they have alternative contact information, most young people have their own cell phones these days, you could always get that information and have a private conversation with the patient at a later date. I think it's also really important to discuss insurance and billing with minors because that is often an issue that often breaches confidentiality is when like the explanation of benefits gets sent home to the parents and they kind of see what services were provided and are able to tell just from that insurance information what might be going on. So it is important to educate minor patients about this possibility. Insurance companies do not have to send home this information. This is kind of detailed information about the services that were provided, but even when you notify them, that doesn't always happen. There was a Guttmacher paper that I think got handed out that goes into some of the risks of insurance violating minors' confidentiality in a lot more detail. So that can definitely be a helpful resource if you're trying to work with an insurance company to make sure that that billing and information isn't being sent home. And again, inform the patient if you think this could be a risk. So as I mentioned, you can notify the insurance company that the minor was treated confidentially and that it's in the patient's best interest not to kind of send home this explanation of benefits that talks about the specific services. Insurance companies have the right to do this, but again, they don't always do it. If there's really that much of a concern about parent or guardian's insurance breaching confidentiality, you can always refer the patient to another health center where services are offered confidentially. For example, a Title X health center, a health center like Planned Parenthood, or another location that accepts family planning only services, which is kind of an extension of Badger Care that teens can use. Even if they have insurance through their parents, they can still enroll in the family planning only services program in order to get confidential sexual and reproductive health services. If you are able to do this, you can also educate your own billing department about the importance of protecting minors' confidentiality. And before releasing any medical records for a minor, you may want to consult with legal counsel just to make sure that that is an appropriate release of records.
I just want to, if I can show you here, the confidentiality thing will now be an issue for those above 18 as well, as kids are able to be covered on parents' insurance up to 26. Their explanation of benefits will still go to their parents. So your 24-year-old patient on their parents' insurance still their parents can see STD testing, contraception too. So.
Yeah, and we do actually, since those young adults were able to stay on their parents' insurance, we've actually seen an increase in young adults coming to Planned Parenthood in order to access those services confidentially. We also try to help them maybe have a conversation with their parents. About these issues. It would be great if 24-year-olds could just tell their parents that they're having sex, but unfortunately that's not always the case. So certainly for your young adult patients who may be concerned about confidentiality, you can also send them to one of these Title X health centers or a health center that accepts family planning only services. Oh, yeah, in case anyone missed that, Paula was saying that there's also now an issue because young adults can stay on their parents' insurance up through age 26 as a result of the Affordable Care Act, which is a really great thing. Kind of one of the unintended consequences is that now, we have these, 18 through 26-year-olds who don't feel comfortable telling their parents that they're sexually active, don't want their parents to get insurance information that says that they were, tested or treated for an STI or they're on birth control. So yeah, these issues certainly now don't stop at age 18. We have young adults kind of experiencing the same breach in confidentiality because of health insurance. All right, we only have about 5 minutes left, and I was hoping we could have a little bit more of a discussion about these, but I think we'll just go through them kind of quickly and see how folks feel about them. So as we go through these scenarios, just think, are you likely or unlikely to make a report in this situation? What additional information might you need to determine if you need to make a report? Who else might you consult with to help you determine if you should make a report? And what is kind of the best and worst case scenario as a result of making the report? So our first scenario, we have a 15-year-old female patient who is concerned that she might be pregnant. Although her pregnancy test is negative, you start a conversation with her about her risk for pregnancy. She discloses to you that she has a 23-year-old male partner and that she often has sex with him under the influence of drugs and alcohol, but she denies ever being unconscious during sex. What do you guys think? Is this a situation where you would make a report or not? Do you feel like you need more information? What other information might you need? Any thoughts? Yeah. All right, yeah, so we have a 15-year-old, and again, sexual intercourse with somebody under the age of 16 is a felony. Pretty big age difference here. It seems like this partner may be using drugs and alcohol to coerce her, even though she says she's never been unconscious during sex. She's still under the influence, which is perhaps a way of this male partner kind of controlling or manipulating her. Any other thoughts about this scenario? You wouldn't absolutely have to make a report in this situation. And so, maybe you talk to her. Certainly the drugs and alcohol might be an issue, but maybe it is a very mature 15-year-old who's really thought through her decision to have sex, and maybe she isn't protecting herself as well as she should be, but she's at the health center. This could be an opportunity to get her on birth control, talk to her about STIs. So yeah, a little bit more information about the relationship could be helpful in this situation. Any other thoughts about this scenario? Yeah. Oh, I think there's a microphone right behind you.
I think information is also important to address the fact that she's 15 and often is using drugs and alcohol. I mean, that's an issue that you can address without disclosing her sex partner. Mm-hmm. She needs to be referred to AODA.
Yeah, absolutely. There are definitely some other issues with this young person: drugs and alcohol, not protecting herself against pregnancy. Definitely things that you can address. All right. So scenario number 2. During the course of a routine physical exam, a 17-year-old male patient expresses that he is concerned about his risk of STIs. You discover that he has multiple sexual partners that are about the same age as him. He eventually also discloses to you that he is engaging in sexual activity with his 35-year-old teacher. All right, report, right? Now I have a question. Would this scenario change if that was just a 35-year-old? So not a teacher, not a coach, not a parent, not a caregiver, just some 35-year-old person out there. Would that change whether or not you would make a report? Maybe need some more information. That's a pretty big age difference, so certainly there's going to be some concern about coercion going on. So you probably are going to want a little bit more information. Now, on the other hand, would your decision to report change if this was a 22-year-old teacher? No. No? Why? Because it's a teacher, right? So it's a person in a position of authority. This is absolutely an abuse of power. Now, again, if this were just another if it were a 17-year-old and a 22-year-old having sex, that alone may not cause you to report, but the fact that that person is a teacher, even though they're pretty close in age, that's the problem there, is that this is a person in a position of authority. All right, and one more scenario really quickly. A 12-year-old female patient is seeking birth control at the suggestion of her older sister. She discloses to you that she has had oral and vaginal sex with her 13-year-old male partner. She seems to understand that these behaviors are putting her at risk for pregnancy and STIs. She also seems to understand that she does not have to engage in these behaviors if she does not want to, but says that she does want to because it makes her boyfriend happy. So what's the situation? Do you make a report, not make a report?
I think more information. It's the last sentence that's kind of the getcha, because she makes her boyfriend happy. So then you wonder what's going on.
Right. Like,
but otherwise, I wouldn't. If that's the caveat for me.
Yeah. All right. So you're worried that maybe she's not making her own choice. It's not something she really wants to do. She's being pressured into it. Yeah. Yeah.
Magic number.
I think you heard me, didn't you?
Yeah, so 12-year-old was the magic number. Yeah. And whose magic number?
Well, I kind of remember learning about it, that the 12-year-old was a child, a 13-year-old was an adolescent.
Yeah, so there may be some differences in the way the law or even your organization or your institution looks at a 12-year-old versus a 13-year-old. I know.
Minnesota, so it might be a Minnesota thing.
Yeah, and it's as far as I know, there's nothing in the law that distinguishes between a 12-year-old and a 13-year-old, but certainly, I think a lot of people do look at it that way, and obviously, every person is different. They're going to mature differently. A 12-year-old and a 13-year-old may not be that different in terms of maturity and things like that. But yeah, certainly I think the big concern here is that this is a 12-year-old. This is a very young person we're talking about.
You said there's nothing in the law. I think there is something in the law that says if you have sexual contact with someone under the age of 13, it's a worse crime. Because I saw a 12-year-old and a 13-year-old, and he was charged with first-degree sexual assault, and she was charged with second-degree. And his was worse than hers because she was under 13.
Okay. I know they're both felonies, but perhaps they can be viewed a little differently. All right. Any other last-minute thoughts about this scenario? All right. Great. There is a resource list at the end of your slides. And thank you all very much for sitting in here and listening to me.